And welcome to the Rehab Podiatrist podcast with me, Alex Murray, the Rehab Podiatrist. For those of you who don't know me, haven't heard about me before, I'm a sports podiatrist and rehabilitation coach based in Canberra, Australia, with a special interest in seeing people with musculoskeletal pain and injuries and helping them go from suffering pain back to performance, whether that be out on the sporting field or just performing back at their peak for daily life. I'm really excited to bring you this new podcast, because the way that I learn is not just through education and reading papers, although I do a lot of that. It's then taking that information and having conversations with people, whether that be academics, senior clinicians, people from different professions, and getting their experiences, getting their perspectives on applying that education, getting the nuance of what we learn from research and how we can apply that best to our patients, and probably ultimately as well, how we can synthesize new information with this wide body of evidence out there, because it is incredibly difficult as a clinician to have all of the different experiences, to be able to hold multiple different perspectives without those experiences, to have a steady load of patients come through so you see this wide variety and just keep up with the evidence itself. So having these conversations, to me, have been pivotal in shifting, changing, improving my clinical practice. Because at the core of it as well, the articles, the information that we get from research doesn't always give us the application. So drawing on what other people are doing in their clinical practice, where they've succeeded, where they've failed, has just been absolutely a game changer in my clinical practice. And now that's exactly what I'm going to try to give to you in this podcast. I'm going to get academics to come on to talk about their papers, senior clinicians to come on and talk about topics and parts of their clinical practice, and provide everyone all of that nuance, all of that different perspective, and try to really synthesize information and provide a clinically relevant listening experience in sort of a nice sort of casual environment. We're not here to lecture or provide a seminar for people, but just to have a friendly conversation, really some models, some discourse as well that we can see or hope we see more out in the profession. So if you like the sound of that, if you like the sound of those conversations, if you're looking for an easier listening, hopefully an easier listening experience when it comes to education, something to really cap off maybe the conferences and the courses that you're doing, then subscribe. The Rehab Podiatrist podcast will be available on all leading podcast platforms, or you can follow me on social media, the Rehab Podiatrist, where I will be also posting updates and clips when new podcasts come available. Thank you, and hopefully see you in future episodes.